Let's talk about doctoring the doctors.
Yes.
Few days ago, we had the Secretary General in the studio talking about their strike. The thing is, the doctors work under such strenuous circumstances, from inadequate water supply, electricity supply, even supply of medication for those supposing to be benefiting from the free healthcare. Long duty calls. They complain some of the hours are crazy long without even a provision of food supply. No increment of salaries for almost about 15 years. This is affecting their mental health. And these are the people who are supposed to be performing surgeries, supposed to be diagnosing whatever is wrong with people, treating them. How do you doctor people when you yourself, you're not in the right mental frame?
Phebean, that's a very, very important issue you raised. You know, again, as I was saying, the hospital is not a building. The hospital, it's its function, you know, what happens in there. And the doctors are central. They're critical to this work that we do for patient care. Their well-being, their welfare is vitally important to this government. To start with, most of the doctors, nearly 100% of the doctors, all of their fees are paid by government of Sierra Leone, by your taxpayer money, to get their training, including postgraduate training. When they go out overseas for training, we ensure that the scholarships are not given to individuals. They're given to the country, and the understanding is they'll go and train and come back to the country to support it. Yeah. At the same time, as I was saying, it's really important to look at the 360 around doctors. First, you need to look at what is needed for 8 million people. We need about 5,000 doctors. We only have about 500, 600 doctors truly functional. So there's a huge deficit there. So we need to be able to forecast the need and train towards that need. As you train towards that need, make sure that you bring in all of the new skills, the new technologies, the new things that will make them truly functional. As they train, you want to deploy them.
How do you bring that in when those who are currently in the field don't see it maybe viable? The Secretary General spoke about a survey they did. Just a minute, Dr. Demby. He spoke about a survey they did, and part of that survey, only 20% of the doctors we have are willing to stay home and serve.
Can I land? Okay, I said you forecast the need. You train towards the need, you deploy based on the need, and you focus on retention. So that's the piece that I was coming to, on retention. Retention has a lot of issues that will let people stay. We've trained about 1,500 doctors over the past 30 years. Only 500 of them are here. The rest have gone. So what we need to do is to be able to figure out a way to retain these people. It comes in compensation, and we're looking at that. It comes in with privileges, we're looking at that. It also involves giving them the tools to be able to perform their trade and ensuring that you could stay here and be actively involved in impacting the health of your people, but also be globally relevant by being involved in active research. So what we're looking at is to say these young people, after their training, in the past you have to go to Ghana or to go to UK or for your postgraduate training. Now we're offering postgraduate training here in country. You know, and as you're doing your postgraduate training, there are opportunities to be actively involved with an R1 grant or an NIH grant, you know, where you could have phenomenal resources made available to you that will help you with your patient care, as well as your remuneration. So we're looking at creative ideas to ensure we retain these staff. Yeah, again, we all think that we're a very, very wealthy nation. I think that's correct. That's very true. We're a very, very wealthy nation. But we're going through a difficult financial crunch as a nation. So when you have these difficulties, the hurt is spread all around, and we try to soften that for our healthcare workers. So, I mean, in a lot of places you sign a contract that after your training, the government pays for your training, you serve them for 5 years or 6 years or 7 years, you know. We don't have that, you know, and people are doing it because they feel that they have a duty to help the community. So again, we have to meet halfway and support them and make life easier for them and make opportunities available to them, even as they serve. You could go to Ghana and make more money. You could go to UK and make more money. You could go to the US and make more money, yeah? But if the people of Sierra Leone paid for all of your education, and then you go and benefit Ghana, and benefit the UK, and benefit the US, is that fair to Sierra Leone?
But it also concerns them that when they go for trainings or so, they perform better than even their counterparts in Ghana. Academically, they perform better.
We're so proud.
Yet we still have our people choosing to go to Ghana in trust, in confidence that they would offer better services and facilities, trusting that their lives could be safer in the hands of the Ghanaian doctors in Ghana than our doctors in Sierra Leone. Why is that so?
This is really, really important. It is building confidence in the Sierra Leoneans to utilize their own services. You go to Ghana, you go to all of these, you go to the UK, and you go to Birmingham. They're Sierra Leonean doctors. You go to Maryland in the UK, in the US, there's Sierra Leonean doctors who are thriving, who are doing extremely well, yeah? And some of them are here. Yet, you know, you go to Ghana and the Ghana doctors are saying, why are you here? When you have the top cardiologist, Dr. Russell, in Freetown, yeah? So what we want to do is to do two things. First, build the institutions, you know, build the Connaught of the future. You know, just go away from that history of 3 years ago. Or when I was here 3 years ago, people were throwing dirt at Connaught. Go and change that reputation, that track record. If I am sick, I'd rather go to Connaught than to go anywhere else. So we need to rebuild the confidence. We need to rebuild the doctors. We have specialty training now for OBGYN, for pediatric services, for psychiatry. You know, here in Sierra Leone, we're only training Sierra Leoneans, we're going to be bringing people from other countries to come and train here. So again, I think we need to have confidence, because I don't blame somebody who wants to go overseas for their care. It's because they don't trust the system here, even though empirically it's better than where they're going to. So we want to build a system here. We want to build trust here. We want to make sure that we use these services here ourselves. And we're expanding it. I just bought, I'm in the process of buying 2 CT scans from a friend of ours who just gave us the money for it. We'll put one in Connaught as a public hospital, and I'll take one to Kenema. And we'll raise some more money to have CT scans in all of these facilities. We want imaging, we want diagnosis, we want critical care. I'll tell you something. You remember there was one story with that young guy who had his tibia broken, snapped, and he was hovering around for a whole year, and it was an internet sensation. That kid was identified. It took him to all of these places. They said, amputate the leg. We were told, if you don't amputate, this kid is going to die in about 48 hours. I said, let me get a second opinion. We got a Sierra Leonean surgeon who looked at it and says, I've seen this before. It's incredible. This guy is the bravest kid I've ever seen, because there are 2 bones in the leg. One is the smaller bone, one is the bigger bone. The bigger bone is the one that snapped. And since he's been hobbling around, he's built strength in the smaller bone. And the doctor said, we're not going to cut this leg, we're going to salvage it. He was able to repair that leg, and to the chagrin, to the shame of all of these other experts who were saying, cut the leg, the kid is roaming around happily. So we have good doctors here, we have good surgeons here, we have good people. All we need now is to increase the facilities for them. I don't know if you've been to the new pediatric facility over at Lumley. Please, you should go there. When I walked in there, I nearly wept. Because this is what you see in Europe, this is what you see in America, this is what you see in Australia. in terms of facilities, in terms of equipment, in terms of space. That's what we're trying to build.